मानसी मैम।
Hello, Asmita. Am I audible now?
Yes, you're
Yes, ma'am.
audible.
Thank you. Thank you so much. So, good afternoon and good evening. Welcome to Homeopathy Musings. So, today we are starting with our session by Dr. Reni ma'am, Dr. Jyothi ma'am, and Dr. Charuvahan sir. It is all about a sneak peek into a contemporary homeopathy, exploring core concepts through the real life cases for practical insights and clarity. Before moving forward, I will just give a quick look at our upcoming and ongoing courses. So we have this ongoing course that is practical application of homeopathy in psychotic disorders by our founders, Dr. Prajakta Vaidya ma'am and Dr. Preeti Shah ma'am. There were two sessions. One session is already done on the 1st of September and another live session is due on the 15th of September. If anybody wants to join to learn the psychiatric disorders and psychotic disorders mainly, I would really recommend to join the session. And if you join now also, you will be able to access the recordings of the previous session. Further, as a part of our psychiatric series, we are starting with our course that is Mastering OCD with Contemporary Homeopathy by
Yes,
Dr.
I
Aradhana
can.
Chitra ma'am.
Okay.
Is a deep dive into mind, miasm, and materia medica. There will be a lot of OCD cases. There will be two sessions, that is on the 21st and 28th of November. Early bird is up to the 15th of October. So do register if you want to and take the benefit of it. Then after the three successful versions of homeopathy, basics of contemporary homeopathy, now we are starting with the version 4. It will be a 16-day sessions and the outlook of the sneak peek, basically the insights of this course will be given today in our session by Dr. Jyothi ma'am and Dr. Reni ma'am and Dr. Charuvahan sir. Before starting our today's session, I'll just give a quick look at the basic hygiene factors. Mute your lines all the while the speaker is speaking. Keep your videos on, which helps in interaction and avoids temptation to multitask. Raise your hands while the speaker is explaining. If you have any questions, you can put it in the chat box and I will address at the end of the session. Please do not scribble on the screen. Make notes, share your experiences and enjoy. For any difficulties or questions, you can contact on the given contact details and we'll be very much happy to help you. Thank you so much. I'll just quickly stop sharing and hand over to Jyothi ma'am. Hello, ma'am.
Hello.
Hello.
Can you see me?
Yes, ma'am.
Yeah. Good afternoon. You should allow me to share. Yeah.
Yeah.
Yes. We will share. Yes. Good afternoon. Always it is my pleasure coming back to musings and talk about homeopathy. Very interesting journey we will be discussing today. That is my journey from keynotes to chakra. I've been practicing homeopathy since 30 years. I always enjoyed practicing because when you meet some people, they say it's boring. I don't want to practice. I'm planning to quit. All those things. But for me personally, practicing homeopathy always, gives me a kick. I personally feel that is because over the years I have been updating myself with something new. There is so much to learn in homeopathy. So I started my practice in 95. When you are just out of the college, you don't know many things because you have read more for the exams than the practice. That is the reality. So when I used to get first, few months of my beginning of my practice, only keynotes were my saviors. Whatever I had read for exams, whatever I had seen OPDs in the colleges. But somewhere over the years, when I was learning new things, I could really connect that keynotes to new things. Nothing new was told, but it made my practice understanding patient more pleasurable. And as all seniors doctors are now no aiming that if 10 homeopaths are together, we need to be coming to at least same kingdom or same family. So in that journey, I think learning new things will help us, all of us, to come to a single remedy. I don't know how many of you are in Facebook. Recently, there was one case presented by one very good doctor. His prescription was on keynotes. I 100% agreed with that case and how it helped keynote and everything. But there was, lot of discussion, lot of, why this, why that, things were going on. I somewhere personally feel basics, all of us need to improve our basics first. If your basics are good, you can pick patient's language from any angle. So that is what today we are going to discuss through one case. I dedicate this, my lecture, to Dr. Dorothy Shepherd. I don't know how many of you have read her books. There is one beautiful volume book, Magic of the Minimum Dose. Today, the drug which we will be discussing, many may not be aware of that remedy at all. We are so much into, new things that we have forgotten there are thousands of drugs in homeopathy which can be used. If somebody asks me why my acute prescription is better, it is because I have read all these books. Either Dorothy Shepherd's or Boric or Allen or Nash. That is the reason I can easily connect to whatever happening in today's. There is one set of people who are still, asking why you are learning new things. Why PM? Why sensation? Why superclass? But when you integrate everything in your practice, it becomes beautiful. Your practice doesn't become boring. It is like, having one good coffee. That type of, energy you get when you solve good case. So if somebody says my acute prescription is good, I dedicate that to Dr. Dorothy only. Now again coming back, there are so many types of practice in our homeopathic field. Some are prescribing only symptoms, nothing else. If you miss something, asking, then it is your problem. Some prescriptions are based only on keynote, some only on miasmatic. Some are doing repetirization. Whatever they get through repetirization, they are giving. And sensation, superclass, and personal evolution method. Everything has plus and minus. But if you learn, if you know about everything, then it becomes very easy for you to practice. Courses like this, basic courses, what we have been doing now, will give you everything in a plate. You have to choose for a particular patient whichever you want. Similarly, now there are so many branded homeopaths. I am a keynote prescriber. Then we belong to this class. I prescribe only on pathological. I am a classical homeopath. I belong to predictive homeopath group. Or I see only mind, or I follow only ICR method. Again, I said there is one set who says only miasmatic prescription. But I am very proudly, I say I am a homeopath who is using tools, different tools, no? All these things, whenever required, to what Hahnemann said in aphorism 2. The highest ideal of cure is rapid, gentle, and permanent restoration of the health, or removal and annihilation of the disease in its whole extent, in the most shortest form, most reliable, most harmless way, on easily comprehensible principles. So my highest purpose of my life is to give patient cure. So for that, I may use any method to help patient. But you need one platform where you can learn all these things, no? This is a platform where you can learn so many things. We are not sticking to anything. If you want chakra, we have. You want miasm, we have. If you want no sorts or codes, everything is taught in this course. So if you want to achieve this, if you want to help patient, you learn everything. Because any case, you cannot stick to one thing, and in any case, you can help patient. So we'll go to case 34 years, female, frequent cough. Started after viral fever 2 months back. Have taken a lot of antibiotics and anti-allergics, but no relief. Took homeopathy medicines month back from other doctor, and it aggravated. Pain in the shoulder, chest and back while coughing. Itching in the throat as if I have eaten elephant foot yam. It's a very, famous vegetable in our area, where I stay in southern India, Tamil Nadu. So a lot of people like this vegetable. So she was giving me example. Sometimes, that vegetable causes a lot of itching if it is not cooked properly. Severe itching causes cough. I cough 2 to 3 minutes continuously. Cough while talking, laughing. Cough is more in the night when I go to bed. First half an hour of my sleep is disturbed. I need to keep something in my mouth like clove or a candy so that whenever I swallow, that irritation is little better. But by the time it becomes um, dry, again I start coughing. Again I'll have itching, then which causes me coughing. So this is how I am. I could sense she was in a really bad state. And husband was with her. See how case can turn in your this. One small symptom can lead you to, beautiful prescription. So he said, doctor, give her best medicine. She is not allowing me to switch on the AC. The moment AC air comes, her cough starts. You know how hot it is outside. Chennai is all 12 months hot only. You can't sleep without AC. Either AC is not working in our room. If at all I switch on AC, she is out of the room. She is also finding difficult sleeping without AC because it's very hot. But it is not allowing her to use. She is fond of ice creams. Maybe that is the reason she developed cough. So from this, case went to somewhere. The patient was little irritated and little angry. So she said, see this man, doctor. I am suffering so much, but he is worried about his AC. Before marriage, my father controlled me. Now my husband. For everything, they have an opinion. When was the last I ate ice cream? She started arguing with him. I tell my mother, why did you get me married? Now you will ask me, where is the connection between this cough, this husband, this marriage? From where to where the things are going. So she said, I love my mother. She was and is suffering because of my father. He never allowed her to lead her life. Her wishes were never fulfilled. She did everything according to his wishes and orders. No one asked her what she wants. She forgot her cough and she is explaining all these things. I am also just listening. Whenever I argued or fought for my freedom, my mother used to tell me, you do whatever you want after your marriage. I don't know in other parts of the India or world. In southern part, no. Mother always says, whatever you ask, I will ask father and tell. She will never say, you ask father. She will say, I'll father. But at the end of the day, it is a mother who is controlling everything at home. So she also knew whenever she have a problem, her fighting is only with mother, not with father. But what I got, whenever I argued or fought for my freedom, my mother used to tell me, you do whatever you want after your marriage. But what I got exact replica of my father. Seems to say all his rules, talks, everything. He does whatever he wants, but I have to do exactly what he says. So much of irritation. Feels like slapping and shouting loudly. So I asked her, tell me about your menses. Because by this time I knew where we are going. Early once in 22 days. 3 to 4 days, very profuse menses. I am getting 3 times in 2 months. A little tiresome. So I am feeling tired. So pregnancy history, first one I had abortion. There is a family history of abortion first. My grandmother, mother and my sister, everybody first pregnancy aborted. I have daughter 3-year-old, normal delivery. Doctor, I don't want second one. It's a burden. So I asked her, tell me your nature. She said, I'm very happy and jovial type. I am responsible, daughter, mother, wife. I am sensitive to being bullied by father and husband. So I asked her, what is bullying? How are they bullying? Because nowadays people use words according to their this. So according to you, what is bullying? She said, why should I listen to and follow their instructions all the time? I get irritated and angry. I fought several times with my mother for same reason. I want to go out of this system. It is not supporting my growth. But my mother says this is what happens in your society and it works for many ladies. She said this is all bullshit. So who is controlling everything here? Between line you have to understand. You may ask at the end of the day, mother never came, but everything is controlled by her mother only. What else irritates you? If it is raining, I want to eat onion pakoda or chicken manchuri. It is not allowed as that day is new moon day. What is wrong? Why it shouldn't be eaten? No, we have some customs, no? On particular days, we don't eat non-vegetarian food. We don't eat onions. We don't eat garlic. What is wrong, doctor? If it is raining, if I want to eat, why is my mother stopping me from eating? Why particular day head bath is compulsory? It is my wish when I want to take head bath, but I can't do what I want. This makes you breathless. Who is she, that is mother, to restrict me? I thought nuclear families are best, but no, mobile is more toxic than everything because everything is gone there. See, your daughter is doing like this. She herself is now over the live during the interview. She told me unknowingly, I tell my mother. Then she will say, why did you take bath today? Today you are not supposed to take head bath. For doctors who are from outside India, India has some rules, for their own. There's a big explanations. But she doesn't want to follow anything. Just because my mother is following, just because my mother is asking me to, why should I do it? Then if I say something, my mother will start advising. Then I asked her, tell me how it should be. She said, atmosphere should be breathable. Give some space now. Give some options to me. I should have a, chance to choose what I want. My husband is not allowing me to do what I want. I want to explore in my own way. I am not baby. I am not allowed to do what I want. Feel like running away from everything. Then I asked her, Ranna, why are you here? Run away. That is how I tell my patient to exactly know what they want. So I asked her, Run, what is stopping you? She said, I don't know. I had so many chances to run away with boys before my marriage. Before marriage, it was my mother. Now I can take transfer from my office and go to other place. But I don't know why I never did that. Maybe now because of my husband. Now that you asked me this question, I will think what is stopping me. I didn't go further because I knew by this time what is what. Then I came back to cough because we stopped, asking symptoms. She went somewhere else. So I asked her, when are you better? When you get cough. She said, I close my ears with cotton. One more thing I forgot to tell you, doctor. Whenever I close my head and face with bedsheet, I am better. But it is suffocating. You can't sleep long time with nose covered with a bedspread or whatever. I want to get rid of this problem as early as possible because I am really tired and it is frustrating. So here, because beautiful acute case. So my keynotes were tickling in the throat with violent cough. So belladonna, hyoscyamus, phosphorus, rumex. Constant titillating cough in the children begins as soon as head touches the pillow at night. So pulse is also there. Now, in the beginning of the practice, belladonna and hyoscyamus I somehow ruled out, but I used to think whether it is phosphorus or rumex. But many cases of cough with the change of weather, when they're very hot, then suddenly it becomes cold and all. Rumex has really helped. I have so many cases where I have given Rumex and they felt better. But why not FOS in this case? Why not Pulsatilla in this case? When you think like that and you want to repertorize and see. So all these symptoms were taken and I got Rumex. And next was the phosphorus. So remedy Rumex 200. There are 4 Rumex. Main is Rumex A, which is very, very useful in the boils. But this Rumex crispus is very useful in skin troubles, cough, and digestive complaints. This belongs to family Polygonales. This is proved by Doctors Jocelyn Jr. and Senior, Bayard and Payne. This is how Rumex looks. It belongs to cactus family. You know, that whole this. Miasm is Kent said in his book long ago. See, this is not a new drug which we are talking. It is Sora miasm. When you use this in chronic case, give dose of calcarea carb to close the case. That is one more method, you know. You give acute, then you give chronic, and also give anti-miasmatic. That was one type of practice we have done in the past also. But now, when you see modern classification, after many miasm added, this comes under tubercular miasm. Why tubercular miasm? We will discuss. So, symptoms of Rumex. Cough always began with the tickling in the throat pit. It's called laryngotracheal cough. Any change of temperature going from warm room to the cold air outside or vice versa brought a violent attack of coughing. Cough was at night about 11 o'clock and before 5 a.m., usually 3 to 5 a.m. Cough is aggravated by eating. Post-influenzaal coughs in some epidemics respond well to Rumex. Even during COVID, no, some of the cases, everything was better, only cough was there. I have given to some patients Rumex and they did really well. Source. It is known as yellow dock. Leaves are rich in iron. Yet the high content of oxalic acid prevents the absorption of iron in the digestive tract. If you have boric, go to ferment and read relationship at the end. There is one very good line. If you have a anemia, then patient develops cough, Rumex is a very good remedy. I'm not telling you exact word, something like that. That is how I, started using Rumex And whenever I feel it is a rheumatoid, then I will ask patients, how is your menses? Most of the times they will say, doctor, I have too much of bleeding. And I had fibroid, I have undergone all those things. And how much is your hemoglobin? They say 8, 9, then confirmed. This is a Rumex case only. Lot of digestive symptoms of ferrum met also resembles Rumex because of the iron content. It was used in the treatment of anemia. Like many desert plants, everything is aggravated in the cold. They are cold inside and they need heat. The plant contains oxalic acid, oxalates, chrysopenic acid, imodin, tannin, and other chemicals. According to Superclass, because a same drug, I want you to know that everything is interrelated. So thanks to Dr. Prajakta, because they are all, super people in Superclass. So I was asking her how do Rumex, because I'm not much, I am learning now. So she gave me some tips. This remedy belongs to third superclass. Bond between mother and child is very important here. But there is one clause. This bond limits their life, but they choose to stay in that relationship because they gain love, care, and nourishment. I asked my patient, no, what is stopping you from running away from here? Maybe somewhere. This is the reason. But whatever love, whatever this they get, they look for freedom in a relationship. So you are all, most of you are aware of this chart. So here it comes polygonals, third column, sixth row. So we will see what PM talks about this drug. According to personal evolution model, this is third column and sixth row. This remedy comes there. Third column, which express the separation from attachment to the universal maternal quality, is communicated in this remedy because of the column. What row says? Extreme conflict and adolescent. See, sixth row is adolescent quality, no? Ranging from the desire to grow and become independent, and the dread of growing up and permanently leaving the maternal archetype. See, if I want to go out of this, I have to leave mother. But I want mother, I also want freedom. In this conflict, they suffer. So here as well, there is a problem with the change. They want a change, but they are afraid to go into the change. The intersection of the column with the adolescent stage results in the attempt to mature and exit the framework provided by the great mother. As Dr. Jayesha sir says, so many things are downloaded. Who told her mother that you should not eat so and so things on so and so days? Her mother, her mother, her mother. See, everything is downloaded. There is one in the link, one in the street. They want to change and go out. They are the one who suffer. So consequently, an emphasis on symptoms relating to the desire, yet unwillingness to become independent of the parent. Sour temperament as an avoidance strategy, and adolescent disposition. So follow up, I gave her Rumex 200 2 times 3 days. Patient felt better for 15 days. See, you and you, I and you, all of us have that, certain patient, when they develop some acute problem, we know this is going to help them. I don't know how many of you agree. I tell my assistants when I am not around, when they call such patient has come, then I'll remember always this patient is better with Rumex, better with Natrum self, better with Heper self, whatever it is, I know. Then I say, you give some doses of that, they'll be better. But why are they coming back? That is where you want to learn new things. According to us, they should not come back no often. When I know Rumex is helping, I am very happy giving her Rumex years. Am I a homeopath there? No. Somewhere I get frustrated. No, there is something missing. Why is every month, every 2-3 months, whenever she eats ice cream, she comes back? This is. Then I give her some dose of tuberculinum. I will tell her, I have to improve your resistance. I'll give you some medicine. Give some doses of tuberculinum because tubercular miasm. Give tuberculinum. 2-3 months better. Maybe she is 4-5 months better. She comes back. I always argued with the friends. Then I got an answer through Dr. Rajan Shankaran's books that a drug which has miasm shouldn't, you need not give any nosodes because it has a miasm and you are helping. So I had repeated many times Rumex. But this case, a perfect Rumex case. So I gave her Rumex 1M. Usually, such drug in the previous years of practice, we have not given in hypertensives. Because that is acute remedy, no? Give acute remedy in a lower potency, they are all right. When they come back, when you read all these, new things, then I gave her 1M. Beautiful. She doesn't come back. She may bring a new patient and comes back to my clinic, but that cough gone. Her periods became once in 26 days. So many problems solved after that. And she is enjoying her office. But I want to know what happened to her other part, no. Other symptoms, what I collected, now I am interested in that also. So if you all remember, I had asked her, what is stopping from exploring new things? She had told me, I don't know, doctor. When I know, I'll tell you. After many months, she told me, I think it is my mother's love and confidence in me, which brings back to family each time. I come back. I want to fight. I want to go out, everything. But I am not able to go out of mother's love. She thinks that my mother has suffered. But what I don't understand is why she is not allowing me to explore freedom. See, most of the mothers know, they say, see, I was so obedient to my mother. This is my mother only told, do all these things, don't do all these things. Listen to your husband, don't fight. If you, because of that, you have suffered. If I want to go out, why you are not allowing me to go out of all these things? So she told me what happened after medicine. I think I will set a new example to my daughter. This is homeopathy. I am not fighting, I am not going out, but I may teach my daughter, do what you want. Counseling to her, counseling to her mother, counseling to husband. I don't think would have given me any such results. Medicines helped her. She understood. Now, okay, whatever I can do, I do. But doctor, I will allow my daughter to do whatever she wants to do. So now, new understanding of the drugs. Chakra is something I am learning, and we have one session at the end of this course, chakra understanding, which will be taken by me. So this is only, a small introduction. So in that we can discuss everything in detail. So column 3 in plant kingdom. Thanks to Dr. Maganjot, because Dr. Gandhi has started all these things, and we learnt a lot from Dr. Mahesh Gandhi sir about chakra. PM and chakra, so beautiful combination. But Dr. Maganjot made some charts of plant, mineral, animal. No, it is really helping in our practice, in day-to-day practice. Column 3, when you want to talk about chakra, it is separation from the womb is governed by the gestation. That is nothing but womb stage and chakra 1, where feminine is a peak compressing the masculine. She wants to go, but she has been made to stick to femininity. So, hence, first impulse of masculine. Here, the main, this is fire element. So, that is seen at the delivery time. Element is, here is fire. So, corresponding chakra is 3. Will also reflect in this third column. So, in the third column, you see chakra 1 and chakra 3. So, where the families is karyophilase and polygonales. This we will be discussing when we take up chakra. So this is a chart by Dr. Maganjot. This itself is a big, webinar. So much is there to understand. But our practice have become, beautiful. Understanding all these PM, chakra. But I have never gone away from my keynotes. I have never gone away from my basics. From the basics, when you have a difficulty in choosing, like I said, no, many cases, I think I was giving Drosera for such cases. Now, Drosera and Rumex is just one column away, few rows away. I never saw, in cases of Rumex, when you give Drosera, they are better because they are very close. But this change as a whole is possible only when you give right remedy. So, thank you, friends. Hope this was useful. So, I'm happy that you all are attending, new things so that you can have so many tools in your practice. Thank you. So, you can go to next speaker.
Yes, yes, sir. Thank you so much. It was like very insightful and deeply understanding. Thank you so much for the brief, sir.
Yes. Thank you if it is useful to all of you. Yeah.
Definitely. We look forward to learn more from you. Thank you so much. Ma'am, I'll just invite Dr. Reni Shah. Yes, ma'am.
Hi. Can I share my screen?
Yes,
Wonderful case, Jyoti, and such a beautiful result. So when we joined our homeopathic college, no, So those days we were told that homeopathy can cure completely. But after starting your own practice, we realize many a times that we don't see that type of cure. And that's why every time you are in search of that remedy to give your patient, that how I can give such wonderful cures. Like out of 10 patients, one patient gives you such follow-ups. So follow-up at such a deeper level that you feel then why not other 9 patients I'm not able to do. And that is the quest, that is the desire that I want all my patients, or at least 70% out of 10, 7 patients, if they give you such kind of follow-ups, you will be happy. And that is where this, what you say as a modern homeopathy or a contemporary homeopathy, but I would not say it is modern or contemporary. It is just our own teachers who are growing, who wants to share their own knowledge about Hahnemannian concept. And that is what our basic course is all about. And take my talk further, like what Jyothi talked beautifully about why this course and how it is helping her in treating her own patients. Like Rumac, she has given 1,000 times in her practice. But when you go in the depth of the case and when you understand this patient belongs to column 3 and this family and patient needs this remedy as a constitutional, the complete perspective changes. I have many such cases in my clinic. I must have presented in past also, and I think we will talk about those cases also today also. So what are we going to do in this contemporary homeopathy course? If you read the material, no, what we have put in the brochure, the main, what we write no, here is the core concepts through real life cases. When I was just reading about this brochure, I said real life cases, yeah, and practical insights and clarity. And that's why yeah, I was just preparing this lecture yesterday, a day before yesterday and yesterday. And I thought, let me share a most recent case which I saw in my clinic just 1 week, not even 1 week before. So last Sunday, somebody is scribbling. Please stop. Mansi, I can't hear you.
Hello, ma'am.
Yeah.
Hello, participants. Be careful. Keep your nose stable on the stage. It's very disturbing.
Yeah. So Sunday evening, you are all enjoying your Sunday evening, and suddenly a patient sends a audio message. His son, this patient's son, sending me an audio message that please look at these pictures. My father has got some rashes on the face, and he's sending me this small video also.
એક મિનિટ અહીંયા માથામાં બી છે વિડીયોમાં નથી ખબર
So
પડતી.
he had some eruptions, and this all came up suddenly from Sunday morning.
इधर देखो ये सब
And something even on the lips.
બી છે વાળ અહીંયા ચોટી ગયા છે ને અહીંયા ત્યાં છે ખબર નથી પડતું શાયદથી કંજોડ્યું છે તો લિક્વિડ નીચું લાગે છે એટલે વાળ ચોટી ગયા છે પ્રોડક્ટ છે થોડું અહીંયા સ્વેલિંગ જેવું બી.
Can you see that? So this patient, no, I had just seen him one day before. Saturday afternoon, he had come for follow-up with his mother. Like he had come to take his mother's medicine, but then he suddenly said that I am having some pain in my gums. And he had a history of pyorrhea in past. So he said maybe that same pus formation has started. And just have a look. So two of his gums were swollen and very red, inflamed. And his constitutional medicine being Lyco, I gave him just 1 dose of Lyco 200. And Sunday, these pictures are coming. So Monday morning, Sunday night, no way how I'll give him any medication. And so I said, let me see him tomorrow morning. So Monday morning he came, and by that time this all had fled up. So anybody with diagnosis? Anyone? Any suggestion? Because this patient can come to your clinic also, and you have to handle these cases single-handedly. That time, no webinar, nothing will come. You just have to handle these cases. Yes, yeah, it is herpes. But see here, what has happened? Just on the second day of the herpes, the patient is getting pus. And you saw the eruptions in the ear on the first day. Second day, his entire ear was full of pus. So herpes already on the second day with superadded infection, bacterial infection. And that is not enough. This patient, just 2 years back, he's been diagnosed with CKD, chronic kidney disease, and his creatinine that time was around 2, about 2. So with lycopodium, he had settled, and his creatinine used to stay with around 1.3 to 1.6 last 2 years. So I was very confident of the remedy. So what I did, on Monday, I gave him 1 dose of 1 ml. Because in herpes, I know, usually you need a little higher potency and not very frequently. So I gave him 1 ml. Next day, this happened. So immediately I know, okay, this medicine is not correct. In herpes, you cannot wait. You cannot keep giving same remedy again and again. If the patient has to improve, next day you get the result. The next day, the eruption stops coming. No, this is 1 day after. So next day when I saw him on video, I realized he's not better. So then I took the totality of the symptom. He didn't have, and best part of it was painless. He didn't have much pain in these eruptions. What pain he had was only ear pain and pain inside the mouth, and he was not able to open his mouth. So that whatever pus or whatever I had seen, maybe that there also he had some herpetic eruptions, and because of that he was not able to open his mouth. His half, like exactly from here, the lips also had lot of vesicular eruptions. Here also he had vesicular eruptions. He was not able to open his mouth. He was not able to eat, and lot of yellow serous discharge coming from everywhere. So any suggestion at this time? Any remedy coming to your mind? Hmm? To the next picture. Hmm. So this is the same day. After giving the second remedy, like Tuesday I gave some remedy, and this is the picture on Wednesday, which he sent me in the morning. But after talking to him, he said that I am able to open my mouth little bit. At night, I had pain for 2 hours, but otherwise, at present, I am feeling little okay. So I thought yesterday only I have given the remedy. Let me wait. I did not repeat the dose, but I just waited. Hepar sulf, Moxol, Calcarea sulf, Miserium. Very good suggestions. So there are many good remedies for herpes, we all know. And looking at this pus, many of all these remedies comes in your mind. But how to differentiate, how to go about? What I had given him on the second prescription was Rus venenata. I had repertorized few symptoms, and in Rus venenata, was covering these vesicular eruptions in the ears also with discharge of pus. So I chose that remedy, but nothing happened. In fact, it increased, everything increased. It didn't stop. So again, on next day, That means this Thursday, just 2 days back, again I was talking with on the phone. Like every day morning I was taking his follow-up. So what he said during the follow-up in the case, what he said, just one weak point in my body and I'm being attacked by bacteria. My entire body is well protected, but just in my gum, I have this pus problem, and now it has attacked my face, my ear, and skull. Everything is upset by just one weak point. You have to be very alert always. If you miss it, you will be attacked. Have you heard this language of any herpes patient anytime? Any suggestion? And I want why also. Because my prescription was based on understanding this entire conversation. Any suggestion? So this takes me to the mineral understanding given by Dr. Rajan Shankaran. This beginning of the contemporary homeopathy, the pioneer of the contemporary homeopathy, who has really given us that evolutionary homeopathy, I could say. He really gave us a different way of thinking and understanding the patient. And when I look at this column 12 of the mineral chart, there is a constant attack on the structure, constant vigilance, alertness, protection, starting to have enemies, threat, attack, struggle, and efforts. What our patient is talking? No, I had just 1 week. My body was protecting because after the diagnosis of chronic kidney disease, he was quite scared, and he used to take care of his diet. He used to take care of everything possible. Only thing that 1 year back he had this little pyorrhea, and the doctor had advised him to undergo a major treatment. He was little scared, and though that time he just did one root canal, and he removed one tooth, and that time he had settled. So 1 year he was all okay, and that day he came up with little bit of pus. So that gave him this entire thinking pattern change, that this bacteria is attacked. I was not alert enough. Like he said, I was taking so much care, no, but I was not alert enough, and this bacteria has attacked me. So this attack and defense, and I have not done something. I have not done something that takes you to the mineral kingdom. The remedy suggestions which came, no, in the chat box, I gave one of that remedy, but this was something which gave me a confirmation that my remedy is correct, and this remedy will give me 100% result. So after giving Merck Sol, which is a column 12 remedy in the gold series, this is today's photographs. Everything has started healing. You can see all the swelling on the face has gone. He's able to open his mouth. He's able to take solid food. Like all these days, he could not eat roti. He was eating shira and rice and khichdi and very, very soft diet. Since yesterday, he started eating everything. Like just 2 doses of Moxol on Thursday evening. This is all dried up. And you can see, no, now here everything is dried up. Even this is dried up. And the discharge from the ear is also reduced a lot. Already, I had taken ENT opinion and the tympanic membrane was intact. Like 3 days back, I had sent him to ENT, but I did not give him any allopathic. He was prescribed antiviral medicines and steroids and antibiotics, lot of things, but I just did not give him anything. And he was also a little scared. He said, I don't want to take any other medication which will affect my kidney. So what is important? What we need to learn, what we need to have is this confidence of treating each and every patient coming inside your clinic. It is not that this is herpes and I cannot treat and I send him to the allopathy doctor, or I give him one homeopathic medicine along with an antiviral medicine. That is not done. And for that, we also have to be very alert, almost like mercury. Any type of patient can come, and am I prepared? Am I ready to treat this kind of cases? And for that, you need to learn every day. You need to read every day. You need to attend all these webinars, seminars. You have to listen to all the senior homeopaths and their clinical experience. And then whatever from their own experience, they have come to some methods. They have come to some conclusions. So take everything from every teacher, and then you never know when it will come to your help one day, when and how, you don't know. But it will, one, if you have heard it, if it's there in your data, it will definitely come to help you. But ultimately, it is you who has to give the result. So a little bit going ahead. So in the journey, this journey, almost Dr. Jyothi said she's also practicing more than 30 years. I'm also practicing 30 years, more than 30 years. So we all evolve in this journey. Day one, no, when I started my practice, I felt I know everything. But today I feel I still have to learn a lot. I want to do this. I want to read this book. I want to attend this seminar. But why? Just to gain the knowledge. It is not that you start applying that method from the day you attend these seminars and webinars. No, it is just to keep in your mind that this is also one way of practicing. This is also one type of technique which I can use in my practice. Recently, I do watch Instagram and I saw one reel by Dr. Farooq Master where he was talking about this remedy, thyroidinum. He said thyroidinum is a very, very useful medicines in dry eruptions with lot of scales coming out. And then second sentence he mentioned, that's why thyroidinum is a very useful remedy in psoriasis. I was struggling with one of my case where this feet, the entire feet had this thick crust, and the patient would just keep scratching at night. The crust would come out, and next day again this thick layer of crust. No discharge, nothing. And same thing in her. And her main complaint was this has become very dry. This has become very dry, and that's why it is paining, and lot of crust is coming out. And just after listening to that reel, no. And after trying all the method, like giving her constitutional, giving her some symptomatic treatment, I just thought, let me give. No, I was just thinking maybe she needs some nosode. And this thyroidinum reel, I gave her one dose of thyroidinum 30, and within 1 week, she was more than 50 to 60% better. There is no PEM applied, there is no sensation method applied, nothing in that case. Because already I had used. I had taken her case in detail 2-3 times. I had talked to her. I had taken the local symptoms, but she was not improving. So what I mean to say is that take everything inside. Keep it with you. You never know when it will come to your rescue, when it will come to your help. Second point I really want to discuss in this lecture is this knowing all these new methods, new technique, and sitting in your own clinic, no, it is your own journey. You understand yourself the best. More than your patient, it is that what we understand for our own self. We get healed by listening to our patients, by listening to their stories, understanding them. Every time you take a new case, no, that patient gives you something. It shakes you from inside. You understand, you want to understand that what is this? And that time you realize that that is your weak point. Maybe this is where you also need to be handled. You also need to focus on this part of yourself. and you go ahead. You understand yourself much better by cases, by understanding your patient, by understanding your own weaknesses and patient's weaknesses. But sometimes something, a story of a patient, if it shakes you, you get really very emotional. First you look inside. Is it your own state which is giving you so much of emotion, or it is really the patient's story is so upsetting? Many a times you will be able to correlate something with your past, something with your own state, and that time then you remove that state, even the patient story will get minder, and then you will see something behind patient story. Sometimes we get really affected by certain things, but that is not important in the patient story. That is important in your life. So that is what you understand when you go through all this training by understanding personal evolution. No, it's personal evolution is literally personal evolution. It is your own evolution. Understanding sensation, going to a deeper level, understanding the source language of the patients. Every time you reach to the source, no, you realize, you see that energy of the patient, you understand, yes, this patient is this case, and you will never forget those cases. And in doing that, the zoom in and zoom out process is very, very important. That you have to go to the sensation, to the energy level of the patient. At the same time, you have to go back and look at the patient in toto. Look at the patient in connection with his family, in connection with his surrounding, in connection with his profession. How is he? That is also an important source of information in treating every case. So how Jyothi mentioned this case of Rumex, no, I will just narrate one or two cases where this some simple rubrics had come to in my rescue of understanding that entire case, because I understood the case, I understood the family, but remedy was very difficult. With that time, even the repertory comes as at your rescue. At that time, repertory or some specific symptom leads you to give the patient that correct remedy. Many of you might have seen one of my case of prunus spinosa. That was also a case of herpes where that patient was coming to me almost 10 years, more than 10 years, and I was giving her some remedies like calcarea carb, kali carb, arsenic, all most of them belonging to the fourth line of the periodic table, which is called as a calcarea line. And then when she develops this herpes, I could not treat her. Her herpes was worse than this patient, what pictures I showed you. But I had to resort to antiviral, antibacterial, everything. Nothing helped her. And even after the herpes healed, she was not better with her neuralgic pain. And that time I choose this rubric from Fatak's materia repertory. Neuralgia, shingles after, and there are just 9 remedies: causticum, calichlor, calmia, miserium, Plantego, Prunus spinosa, Ranunculus bulbosus, Variolinum, and Zincum. And out of this, 5 belongs. Like Zincum is fourth row, Calichlor is fourth row, but at the same time, fourth row corresponds with the column 5 of the periodic table. And in column 5, even the causticum is fourth row, but column 5 is Calmia, Miserium, Prunus spinosa. 3 remedies from column 4. And then I studied these remedies in detail, and the entire picture of this patient, no, it matched completely with Prunus spinosa. She was belonging to the column 5th and the womb stage. Her anxiety matched, her conscientious match. She had one typical laughter, like she would laugh on small matters. That cheerfulness rubric is that a single symptom rubric in Prunus spinosa, and everything match. And I maybe in 2018 or 19 I gave her Prunus spinosa for that herpetic neuralgia. And since then, this is 2025. Whenever she comes to me, it is only one remedy, which is Pruna spinosa. Her frequency of coming to me has gone almost once in 6 months. She's much, much better at mental, physical, general, and social. All the levels. The patient has improved with just single remedy called Pruna spinosa. But I understood this remedy not from only from this rubric or only from the herpes, but from personal evolution method and from Dr. Yakir, from Yakir's botanical book on plants. So this is how I want you also to look into many a times many a times, no, especially the subacute cases, no, it gives you a lot of deeper remedy in the case, and that deeper remedy can be a constitutional remedy. Just hold on to that remedy and you see the miracle, how that Jyothi hold on to Rumax, went to 1M, and such beauty you saw. Another case I want to share, no, that young girl, no, she was thorough pulsatilla case. She had this aggravation from change of weather, this cold, that thirstlessness, and weeping on small things, and extremely sensitive patient. But pulsatilla did not touch her. Whenever I would give, with a confidence, with the totality, with that case, I had that 5-6 page case and no other remedy I could think of. I always thought this patient belongs to first subclass of the plant kingdom. But pulsatilla didn't touch. Then I went to Staphylococcus aureus, didn't help. Then I gave her cocculus, it didn't help. I gave her colophyllum. During cocculus and colophyllum, I gave her during her pregnancy, because during pregnancy she went into a severe depression. She would just sit and weep and weep and weep, and nothing could console her. I said, what to do? What to do? And that time she developed cold. So I told her, just give me all your symptom of the cold again, because she had to begin with also, she had come for her cold. And suddenly she remembered that whenever I get this cold, I feel very giddy. And this is from my childhood. Like every time I get cold, I said, you never told me this. She said, I forgot. Like when she was getting up, no, she told me this symptom. So I searched in the repertory, vertigo, coryza during. And I knew what I'm searching. I want a remedy from first subclass. There is only one remedy from first subclass, which is Helleborus. Helleborus we know for people, no, who just sits quietly and stares in the corner. That much I knew, and I had prescribed it once in a while to 1 or 2 patients. I said, but I must try this remedy. And I think this was 2022 or something. She delivered normally. Her son is now 3 years old. As and when anything happens to her, Helleborus 1M, 1 dose, and she's all better. I would tell her, continue the medicine, continue to take it for 15 days. But most of the time, she will not even finish the doses which I've given her. Just first 1 dose is enough, and she's better for 5, 6, 7, 8, so many months. And then again, one day she'll come up with some other complaint, and 1 dose of Helleborus. This kind of confidence comes only when you are very, very sure of the kingdom, when you are very, very sure of the column or the row, or when basically you are sure that you have understood your patient. How this patient in herpes, no, he speaks this language. If my ears are not alert enough, if I wouldn't have known that all these 18 columns in the periodic table, every column has one issue. At column 11, it's a peak, and they are the king, aurum or the platina and all. But when it comes to column 12, the attack starts. They feel threatened by this outside world. And this understanding, no materia medica gives. This understanding comes from Jan Schalten and Dr. Shankaran, Dr. Mahesh Gandhi, all these teachers. They are constantly teaching us this way of looking at a group, at group of remedies. You are zooming out and looking at 3 remedies in the same column. What is common in this? And then this understanding of Merck comes up. Same way, this understanding of Helleborus is through the column 1. These patients, most of the patient looks like pulsatilla. They are very soft, very gentle, very sensitive. They are pulsatilla and Staphylococcus aureus is the commonest remedy, no, in this column. But after understanding column 1, I have almost 5-6 Nux cases. I have Helleborus, I have camphor cases. So many new remedies you can explore just by understanding this column theory and then using your old techniques together. What else in my clinic I do? You have to keep all your senses alert. You just don't watch, you observe your patient. You are watching also and you are observing. That is very important. You are hearing, but at the same time you are listening. Listening in between the line, listening the tone. When the patient's tone is going up, when the patient, which word patient is putting a pressure. And for everything, what you need, you are feeling it. You are getting emotional. But take a sit back, just be empathetic with your patient. Don't get sympathetic. Be just empathetic with your patient and you see how easily you will be able to solve your case. Awareness of all the new concepts helps us to help our own patients. So how much time still? 3:20. So I will not do a little longer case. I'll just do one more short case. Another case, short case, recent, which I saw in my clinic, say 2 months back. So those days, no, there were many fever cases. But what this case was worth sharing. First day evening, the patient, this was also Sunday. Sunday night, I think around 8:30 or 9 o'clock, that patient's grandmother is calling. That because nobody was at home and she was only there, and he's around 21, 22-year-old, but suddenly his temperature was 105. So I didn't have any resources with me. Already he had taken crocin. So I told them that get Meftal and give him Meftal. From next day, the fever was between 100 and 100 to 103. He had severe headache, bitter taste in mouth. The food was salty. He said, my mouth is bitter, but the food tastes salty. BP was low. He just could not get up. He said, I feel I'm just falling. I just cannot stand on my feet. I don't have any balance. And I told, then by that time somebody came home, I told him just check his pressure, and which was 90/56, just out of the blue. A young, healthy boy just attacked with some viral infection and it's completely collapsed. And he said, I have constipation since 2 days. So I had repertorized that day, and then lycopodium was coming. So I gave him 1 dose of lycopodium, 1 ml. And then third day I gave him in water, because with lycopodium, no, fever would not go above 102. So for that, I thought it has gone to 105, so let me wait. In this viral, no, sometimes it takes 3 days to respond. So till third day I waited. And then on third day he developed diarrhea, along with nausea, severe gagging, and slight vomiting. But his pressure improved to 106, 110, which was also not completely normal, but close to normal. And his fever continued. First day only, like Monday only, I had got NS1 test and the malaria antigen and CBCs to just check the platelet. Everything was normal, except I think his WBC were around 400, 4,000. So this is the first repertorization. Bitter, hypotension I took, headache, salty food, constipation with fever. Lipo was fourth, but I gave him lipo. Nothing worked. On the fifth day, the fever was throughout the day, and from the second day, I had stopped all the paracetamol. I just told him, don't take anything. Anyway, his fever never touched normal. It was always 100. And at night, it would go 102. Then again, I took his history. Headache with pain in eyes. It pains with specs. Movement of eye aggravated on the right side, the headache increases. He was sleepless yesterday night. I said, what happened? Why sleepless? He said, I had too many thoughts. He said, I'm not sure they were thoughts or they were my dreams, but too much thing was happening. I said, just talk about it. He said, I'm going here and I'm going there and I'm out. I'm doing some work. So asking of mental symptom during in treatment of an acute illness is also one of the way which I have incorporated in my practice, and this really helps you. There was an event going and I'm going to airport to leave some guest. So lot of things were happening in his dream. Then he said there is another dream where I'm sitting in a court. I said, what? Yeah. He said, I am being called to the court in a hit and run case. But I know that I'm not involved in it. But I'm sitting in the court and I'm arguing with the judge that why I am sitting here when I have not done anything. So a patient whom you know from the childhood, you know him, maybe sometimes you don't get the remedy, correct remedy, but this kind of thing, he has never talked to you. Nothing is there in his life to talk like this. And suddenly he's getting this kind of a dream. I said, what is this? And other symptoms, sweating and chilliness, lot of bloating. He had started getting some rashes on the face. He said, suddenly I feel hot, suddenly I feel cold. And giddiness is still that. First step, I lose my balance. Step is very difficult. Then again I asked him, what about, tell me more about this dream. What do you feel about this dream? He said it was out of context dream. I was very restless in the sleep. I was on the edge of the bed. I was rolling in the bed. And fourth day, I had done his typhoid dividal test and even typhoid antigen. So typhoid antigen came mildly positive on the fifth day. But on that day, his WBC count was 2,500, which indicated that this is more of a typhoid kind of fever. So any suggestion based on this symptomatology? Anything, what you will give? Such fever cases are not easy to treat. Most of the patient on fifth day, either they get hospitalized or they go and take allopathic medications. Because you are treating this patient, this entire family, they have faith, they want to stay with you. But if you don't give result, you have to tell them to go to allopathy. Yes, Rustox, China. What about this dream? Let's talk about this dream. How will you analyze? How will you understand this dream? Baptisia. So here, no, this patient, I'm also struggling to get the right constitutional remedy. I was because he was from adolescence to in his transition phase. He was struggling with lot of illnesses in last 2 years. Like he had backache and he had some injury issue, and then he had some eye problem. And every time I would sit with him and take his totality and give him a new remedy. So for me also, I was not very sure about his kingdom. I was not very sure about his column. So that way also, I was little blank. So I took some rubrics, like I kept his previous totality. I added few more, like taste bitter was still consistent. Hypotension was there. And after second day, no, the food also had started tasting bitter. This headache motion of the eye is aggravate. Then eye pain during headache. A lot of eye symptom with the headache. And then I saw he had this indented tongue. And then I added, because I had this report of mildly positive typhoid. So I added this symptom, fever, heat, continued typhoid type. And then I found one nice rubric in the mind section, dream accusations of crime of wrongful. And like I was searching, I was trying to understand what does this entire dream means. And I have to have a remedy which has this symptom. And I found this rubric. And then when I'm repertorizing it, I got Rustox, I got Natromu, Sepia, again Lyco, then some other remedy. What came in suggestion? China is here. Baptisia, Baptisia is very, very different, no? Separate, body is separated, limbs are separated, nothing like that. But in the top 5, only remedy which covered this dream was Thuja. So would you give him a patient who is into this acute, subacute type of fever, like 5th day of fever, running high temperature, not able to eat, or very, very badly dehydrated? What will you do? Out of all these remedies in the repertorization, what remedy you want to give? And what potency? So what I gave him is just Thuja 1 ml, 1 dose. I did not give him anything throughout the day. And the next day morning, the fever was normal. Like he messaged me 98.2. The fever is 98.2. As his state was very bad, I did not completely stop giving medicine. I had given him and gave him as and when needed, because I knew usually in viral, this fever, though it touches normal, one more spike comes and then it settles. Recently all these fevers, I'm not sure what I treated. Typhoid was mildly positive, WBC had gone down, and even the platelet had started going a little bit down. But his dengue was negative. His malaria was negative, typhoid was mildly positive. And like after that, just one spike of fever, that was also 100, and then no fever at all. His weakness and all took 1 or 2 days to go. So I think this is the way I do in my clinic. Every patient needs a different way. Every patient needs a listening ear or a focused eyes. And first of all, our own passion of in homeopathy, the patient gives you that faith. Why this herpes patient is still with me? Where he came with that prescription of antiviral and so many medications, or this patient with such a high fever, why they are still with me? They don't go to allopathic doctors, because you are treating them with that conviction. You are treating them with that faith that yes, I will treat you. You give me symptom, I will understand it and I'll treat you. And for that, you need to update yourself. You need to read a lot. You need to give lot of time to homeopathy.